Good morning, our listeners of Sun FM radio and TV. Today, on the 3rd of May in the year 2025, I'm glad that you could join us on the latest edition of Health Talk. I'm your host. My name is Lamek Zulu, professionally known as Four Legs. Today, we are talking about non-communicable and communicable diseases. Obviously, that will also include HIV. And to help me discuss this very important topic, I have Dr. Mwale Po, who is a Provincial Advanced HIV Coordinator, and obviously he is going to be sharing some knowledge with us in that regard. Then I have Mrs. Josna Palmer, who is the President of the Lions Club of Undola, and last but not the least, I have Lion Patricia Makulu, who is the District Committee Chairperson for HIV and AIDS. In today, this is very, very important, and obviously, let's start by defining what communicable diseases are.
Great. So thank you so much again for our community today. In the first place, I'll just in Zambia. I think we are able to remember, most of us, that when somebody came down with HIV, they came with the diagnosis of HIV. There were certain conditions that we are so prone to, and these were, most of them were opportunistic infections back then. Diarrheal diseases, TB back then, dying because of, and usually they take time to manifest. They've got a very, very slow, progression or development, and you would find that because they take time, to diabetes mellitus, we'll simply put sugar, high blood pressure or sustained high blood pressure, in this case hypertension, for example. You think of condition like maybe kidney failure, cancers that we are seeing today. It could be a breast cancer, it could be cervical cancer. And as they gain weight, what we have known is that when somebody is gaining weight, it looks like it's a very as people are living longer in HIV. Thank you.
Okay. Madam Palmer, I'll get to you. What are the most common types of these non-communicable diseases that we're talking about?
So,
yeah.
Okay. Just like he did allude to, maybe we look at the risk factors of these non-communicable diseases.
Great. So there are quite a number of risk factors. Now, what we have noticed is that HIV has moved from an acute. Let me put it that way. You may find drugs, for example, there's what we call TLD, which is a combination of 3 drugs. But what we're interested in there is a drug called dolutegravir, which is DTG. So dolutegravir has been shown to cause weight gain. It has been shown to cause, hyperglycemia, especially a drug called TAFI-D. These have been shown really to have significant weight gain, and what has been shown is that when somebody starts ART within 1 year, there will be a weight gain of about 2.5, which is normal. So here we say it's a return to health phenomena. And when you put them on ART now, they have to get back to normal weight. So that's a normal weight gain. But afterwards, it becomes a pathological state. It becomes a disease where, the normal, I'm sure you've heard of what you call BMI. Body mass index, where you get your weight. And
yeah. But how do you treat somebody who has diabetes?
So it's a whole comprehensive package, and the Ministry of Health, I think we have done extremely well. Remember that when you are managing this condition, you initially, before they were integrated in the HIV program, you are going to have a patient having diabetes. Then they will need to come for their HIV service in the ART clinic. So meaning this patient who have, will spend a lot of time in the hospital, if let's say they were given on the same day, or they were given on different days. So maybe ART clinic falls on Monday, and then medical clinic falls on Friday. So this client has to come to the clinic or to the hospital twice. for some like, feeling so thirsty? Are you eating too much? Are you passing so much, urine, for example? So it could poison, if it's, blood pressure, will do baseline test, just blood pressure itself. And then, of course, afterwards, when it comes to management, it depends on what we find. If you need, maybe just lifestyle modifications. If you're not exercising, please go and start exercising. Okay? If you are having, there are people just love meat. At one point I used to tell my wife that I suffered so much. So you need to moderate good when it comes to don't drink and drive. Okay? Because if you drink and drive, it can result in an accident. That's an NCD. So you may have this recipient of care.
Madam Palmer, how has been the response so far?
When we hold the clinics, it's been very good.
So
People do help, and the advice, and also the self-testing kits. We provide those as well for people. So it has been useful and beneficial to the community.
Madam Patricia, do they pay anything, or you give this care for free?
They don't pay anything. We give this care for free as Lions.
As Lions,
Yes.
Club of Undona.
Yes.
So, Doc, you've been working with the Lions. How do you think this collaboration has helped? Get the much needed data in terms of how many people have must be on this medication.
Great. So working with the Lions Club of Ndola and the other different. If you are my recipient of care, you say, I don't want to come to Ndola Hospital. I can't force you. Okay. If you want to be seen, for example, it doesn't look like we're pilfering drug. Okay. So all records must be put in place at the facility. Everyone must be notified that, we have got recipients of care who are not so comfortable, but they will still need these services. Okay, so ministry says, please provide that service. It's differentiated care. They are not comfortable to come, you follow them out. Okay, so Lions Club has provided that platform. Even where we are here, I think it's Lions Club of Ndola who brought us here.
Yes.
And people are actually learning, they're getting more information. So this is how much we've collaborated with Lions Club of Ndola. Thank you.
Reminds me of home-based care.
Yes, yes.
Okay, in terms of message, what message would you have for somebody who's was just being diagnosed with HIV?
You understand, Okay, and so you can also. But what was like we said, we see these conditions more in the recipient of care on HIV drugs. Okay, so what is the message? The message is that please, much as we know that the ART drugs, when you put them on drugs, their life expectancy increases. Okay, this is what we have seen actually. Okay, understand?
Yes.
So much. Let's say somebody lives for 100 years.
Exactly.
Okay, that's the life expectancy. Okay, from the time they were born up to the time they die, that's 100 years.
Yes.
That's their life expectancy, which we call the chronological age. But there's also a very important aspect which you must factor in.
1st December.
Yes, that's right. We also hold medical camps like we're discussing, where screening takes place.
How often do you do that?
It depends. As Lions Club of
Varies,
Ndola,
yeah.
we normally
At least once in two, maybe twice or three
Maybe
times
twice.
in a year.
Yeah.
2 times in a year.
But-
Yeah.
it depends on
It
the agreement within the club. Then we also make donations to people living with HIV and AIDS, and this can be done at club level or even at district level. We also have sensitization programs where we engage the community through media, like this same one we have right now here. And we also do the
They also don't know the HIV status because I may think I do not have HIV now, but perhaps I have it. It's the point. So therefore, I'll be driving it. That's why I always encourage somebody, please. It's important, just know HIV status. Look at all these NCDs we're discussing now. Two people, both of them are positive. This one is on HIV drugs. This one is not on HIV drugs. So the one who is actually on HIV drugs, of course, is likely, and because when they're on HIV drugs, they are likely to suppressing, the virus. So the number of viruses in the blood is going to be low. Okay, and information I talked about earlier. Okay, compared to one who is unsuppressed. Therefore, when you compare these two people, studies have shown like a man. Okay, HIV behaves like a man. It's just that Mama and Mrs. Palmer are older than me, but I'll give an example on them. However, please allow me to do it.
Oh, sure.
Okay? My own part B is not listening at all. Yeah, so if I'm interested in Madam here, and she's not interested in me back, I will try everything. I will not use force. I will try everything possible to make sure that she accepts my proposal, because it's something I'm interested in. Okay, the moment I use force, she's going to repel me. You understand? Until I get what I want. But if she becomes pregnant and I didn't want anything longer with her, then I'll change my mind. You understand? So meaning, when going in, when talking to her, okay, in HIV again, get this one stuff, okay, another stuff called a protein. It will also nicely bind to there, and then there will be harmony between the two. And then my cell will now accept it. You understand? And then afterwards, once HIV gains entry into my cell, that's where my life is. Then once it does that, my cell will continue working normally, okay, thinking it's producing my own proteins. And yes, it's making that for the virus. Then when coming out, it comes out by force. You can't limit it. It will just leave you dead. And that's what a man does. When going to her, I'll do this. Okay? Now, there are people who have got actually changed or mutated co-receptors. If they have got mutated co-receptors, HIV cannot bind there. It cannot gain access to the cell. Simply, they cannot have HIV. So now there is no blood group that will protect anybody from it.
Let's see if my listeners have questions. Plus 260 212 617140. You can use that number to come through and ask one or two questions, or probably just comment on this lengthy discussion that we've had. I mean, this is no more. As well, plus 260 212 617140. Alternatively, you can send us a WhatsApp message on 0769 122851. Okay, plus 260 212 617140. Oliver, do I have a call? So there are no questions. Okay, so let's conclude. Just your concluding remarks, Madam Patricia.
No, I'm so grateful that this program is being.
Imagine somebody is on HIV, and then they're living with somebody who's not on HIV. At what point do they start meeting?
So you've got one who is HIV positive?
I'm imagining this is a couple. Yeah. Is diagnosed with HIV. The other one is not. At what point do they start meeting?
Okay. Great question. Yeah. So again, ministry, we are slowly moving away from saying a discordant couple. We're now saying it, because people are saying it was discriminating a little bit.
Okay.
So we are saying it's now seroprevalent. It's different. Okay, so because they are different in terms of the HIV status. So it's a very important question, and these things are happening in community. At what point do they need? No one will get HIV. That's what has been demonstrated by research. Okay, but if I'm still, virus not suppressed, the number of virus is still very high, above 1,000 copies per mil, then at least there should be protection. Okay, let there be a condom so that my partner doesn't get, because this transmission depends also on what you call are they viral suppressed? Wow, they can actually enjoy it, because imagine they want to have children. Okay, so if we simply say you are positive, so you cannot be having no contact, it's difficult.
Yes, it's very difficult.
Exactly.
Okay, now my phone's now my phone is ringing. Okay, Oliver, let's pick these two calls, then we can allow the doctor to answer. Good morning.
Morning.
Yes, I'm glad that you could join us on today's health talk. Who are we talking to?
I'm Msenge.
Where are you calling us from, Mr. Mseng?
I'm from Masara.
Okay, go ahead with your question, comment, or contribution.
Okay, in as much as you are sensitizing concerning HIV and AIDS, my concern is on those people you put on health centers for VCT. Because last time I was very much disappointed. I went to do a VCT, and the lady asked me, like, where is your partner? And I told I'm just single, but she insisted that I should bring a partner. Is it okay that always we should do or go with our partners whenever we want to do a visit, or is it mandatory, or what is the procedure?
Okay, Doc will attend to that. Thank you very much.
Okay.
Doc,
Okay.
you can give us expert advice.
Wow.
Please.
So I know you're so depressed, you know. It's so or I got it from my sexual partner, or we are sharing, you know, injections because we're abusing drugs, okay? Whichever way it is, but there was a transmission somewhere. Now, there's what you call, you know, partner notification services, okay? Or in